We are FienA and MarliesH. This is a video presentation of our scientific article to obtain the DO diploma at the International Academy of Osteopathy. Our promoters are Kim van Overbeke and Bart de Zwaaf. This study examined the effect of a general visceral osteopathic treatment on the oxygenation of the upper and lower extremities within a group of men and women between 18 and 65 with digestive complaints. The introduction. The cardiorespiratory system plays a key role in the regulation of tissue oxygenation. At first, oxygen will be inhaled from the atmosphere. Second, the oxygen will be transported by diffusion to the blood from the air in the alveoli. Oxygen diffusion to the plasma and the elimination of carbon dioxide take place in the lungs. The hemoglobin molecules in the red blood cells carry out mainly the transport of oxygen from the lungs to the tissue cells. Arterial oxygen saturation or oxygenation is the amount of bound oxygen in the arterial blood. The level of arterial hemoglobin oxygenation is assessed by arterial oxygen saturation, which is the ratio of oxygenated hemoglobin concentration to the total hemoglobin concentration in blood. The oxygen dissolved in plasma and the hemoglobin-bound oxygen constitute the total oxygen content in blood. Pulse oximetry is a non-invasive technique to assess the arterial oxygen saturation. The normal oxygen saturation values in adults measured by the pulse oximeter amounts of 93 to 100%. The oxygen concentration in the tissues has to be maintained within normal limits in order to obtain a normal degree of activity. Limitations of pulse oximetry, such as low perfusion state, anemia, skin pigmentations, dyes, nail polish and motion artifacts, may result in erroneous readings. Our body is a biological unit in which each body part is connected to each other by the facial continuum, giving form and function to every tissue and organ. The facial tissue is equally distributed throughout the entire body, enveloping, interacting with and permeating blood vessels, nerves, viscera, meninges, bones and muscles, creating various layers at different depths and forming a three-dimensional metabolic and mechanical matrix. Due to this three-dimensional metabolic and mechanical matrix, a decrease in movement of the various connective layers, also called facial stasis or adhesion, can create a mechanical pressure on the arteries that run through, which can result in a decrease in vascularization and in this way possibly cause a decreased oxygenation. Next to the effect of adhesions themselves on the vascularization to the extremities, this research is also based on the principle of viscerosomatic reflexes. A viscerosomatic reflex is based on an efferent impulse to several spinal cord segments, commencing from a visceral disorder and adhesion, resulting in a hypersympathetic tone of these segments. Vasoconstriction to the viscera, skin and body wall, and vasodilatation of the blood vessels of the skeletal muscles, heart and lungs results from a normal sympathetic tone. In case of a hypersympathetic tone, there is a malfunction of this mechanism which can result in a decrease in blood flow and thus possibly decrease the oxygenation. An adhesion reduces the mobility of the organ, causing a malfunction which could result in symptoms depending on the affected organ. For example, an adhesion of the angulus splenic can cause constipation and flatulence. Since viscera of the digestive system are present in the thorax, abdomen and pelvis, adhesions in each of these regions can cause digestive complaints. This study included subjects with digestive complaints because these are more likely to have adhesions in the thorax, abdomen and/or pelvis. Therefore, this research hypothesizes that a general visceral osteopathic treatment, further also called a GVOT, improves the vascularization to the upper and lower extremities of people with digestive complaints by correcting the adhesions, as a mechanical pressure on the blood vessels will be released and the viscerosomatic reflexes will be treated, and this also increases the oxygenation of the upper and lower extremities.
The objective. The purpose of this study is to examine whether a GVOT improves the oxygenation of the upper and lower extremities of people with digestive complaints, since there is limited research on general visceral osteopathic techniques and its effects. Assuming this, a GVOT could possibly be used to progress healing and to improve the functioning of the extremities. The material and methods. 29 participants were recruited in December 2015 from the clinic of the International Academy of Osteopathy in Ghent. The inclusion criteria implied healthy subjects of both genders with digestive complaints such as bloated feeling, cramps, constipation, stomach ache, diarrhea, flatulence, heartburn, regurgitation, nausea and vomiting, age between 18 and 65. Subjects were excluded from the study if they tested positive on the hepatojugular reflux test and/or the osteoporosis test. They were also excluded if they would receive another manual treatment during the study in order to avoid interference with measurements. Other exclusion criteria for the study were pregnancy, cancer, acute infections or inflammations, osteosynthesis material or joint prosthesis at the height of the torso, severe musculoskeletal deformity or injury because of the complications and diagnosis of pathological condition of the cardiovascular, respiratory, gastrointestinal and/or genitourinary system. The participants were divided into two groups by the drawing of lots when they entered the room. Subjects with number 1 received the GVOT, Group 1, and those with number 2 received the sham treatment for the same duration, Group 2. After signing the informed consent, the subjects were weighed and measured. Before the treatment started, the hepatojugular reflux test and the osteoporosis test were done. Pulse oximetry was performed with the OxyTrue-A pulse oximeter before and directly after the treatment. The pulse oximeter probe was placed on the index and on the second toe to measure the oxygenation of the upper and lower extremities. The temperature in the room needed to be the same in order to prevent an error. The subjects had to come once a week, 3 weeks in a row, and the same procedure was repeated each time. The GVOT consisted of the 8 following techniques: sternum recoils, rib recoils, stretch of the intrathoracic facial chains, mobilization of the upper ribs towards inspiration, mobilization of the lower ribs around 3 axes, anteroposterior axis, craniocaudal axis, transverse axis, diaphragm dooming technique, subdiaphragmal decongestion technique, great abdominal maneuver, fossa ischiorectalis technique. The sham treatment consisted of contacting each region of the different GVOT techniques for 1 minute. This took approximately as long as the GVOT techniques. All analyses were performed using the software MedCalc. The statistical distribution of the data was analyzed to test for normality with the Shapiro-Wilk test. In case the null hypothesis of normal distribution wasn't rejected, p-value greater or equal to 0.05, the paired student t-test was applied to compare the oxygenation values within the groups, and the independent student t-test for the comparison of the oxygenation values between the groups. In case the null hypothesis of normal distribution was rejected, p-value lower than 0.05, the signed rank sum test was applied to compare the oxygenation values within the groups and the Mann-Whitney U test for the comparison of the oxygenation values between the groups.
The results. We had to exclude one subject at the beginning of the study because of a measurement error. The 28 included subjects, 14 in each group, ranged in age from 19 to 61 years. They were 1.57 to 1.95 meters tall, they weighed 50.2 to 98.2 kilograms, and the body mass index was between 18.85 to 31.34 kilograms per square meter. 7 of the 28 participants were men, the other 21 were women. The demographic characteristics between the two groups were compared and showed no statistically significant differences. This table shows that bloated feeling was the most common digestive complaint, followed by cramps, constipation, and stomach ache. Very few p-values could be calculated for the comparison of the oxygenation values of the upper and lower extremities after treatment 3 minus before treatment 1 within the two groups, due to the limited changes in oxygenation in both groups. Either there is an indication that group 1 potentially had a bigger effect because 3 p-values could be calculated for group 1, and only 2 for group 2. Still, all p-values were insignificant. No significant changes occurred for the oxygenation values after each GVOT and on long term after all 3 treatments in comparison with the control group. P-values after all 3 treatments for the upper extremities were slightly lower than for the lower extremities, potentially indicating a bigger effect on the oxygenation values of the upper extremities in group 1 than group 2. This table shows that the oxygenation values of the upper and lower extremities remained equal for most of the subjects, whether they received a GVOT or the sham treatment. This figure gives a visual representation of the effect on the oxygenation of the upper and lower extremities after the 3 treatments for both groups. The discussion. In the literature, there is still no link shown between oxygenation and general visceral osteopathic techniques and their effects. This research hypothesized that the GVOT would improve the blood flow of the upper and lower extremities of people with digestive complaints and thus also increase the oxygenation. No statistically significant changes in oxygenation were revealed after each treatment and the long term in comparison with the control group, so this study was unable to prove a link as well. Due to the small sample size, only a few p-values could be calculated. The slightly lower p-values after all 3 treatments for the upper extremities than the lower extremities can be an indication for bias during the measurements. Measurement errors of the oxygenation of the lower extremities can be caused by the cold floor in the treatment room, which possibly had an influence on the body temperature, and by motion artifacts during the measurements on the toe. There was less chance on bias during the measurements of the oxygenation of the upper extremities. Normally, there is an equal oxygenation in the upper and lower extremities because oxygenation is the amount of bound oxygen in the arterial blood, resulting in the same oxygenation value in the whole body. Taking this into account, measuring the upper extremities would have been enough. Maintaining a stable temperature in the treatment room wasn't always easy. The heart rate and breathing rhythm of the participants were possibly influenced by whether or not rushing to be on time and by feeling uncomfortable in underwear. These facts could have had an effect on the measurements as the cardiorespiratory system plays a key role in the regulation of tissue oxygenation. For the same reason, adding some specific treatment techniques on this system to the GVOT could result in an increased oxygenation. Measuring the oxygenation by an invasive technique, for example taking a sample of extracted blood, is known to be more reliable than pulse oximetry. The chance on bias could be reduced by using this technique in further research. This study used healthy participants with normal oxygenation values between 93 to 99%, so the chance to improve the oxygenation was low. Participants with a cardiorespiratory disorder, for example asthma or COPD, could have an obvious decrease in oxygenation, which could make a bigger increase in oxygenation possible. Because adhesions cause a decrease in vascularization, and this research was not able to prove an effect with the GVOT on the oxygenation of the upper and lower extremities of people with digestive complaints, it is suggested to examine the effect of a GVOT on the blood flow in further research. It would be necessary to measure the blood flow in the upper and lower extremities with the echo-Doppler technique, since adhesions can be located in different regions and depending on the region of adhesion, the blood flow to the upper and or lower extremities would be decreased. Furthermore, performing a technique until the adhesions are corrected would be better than performing each technique of the GVOT a fixed amount of times. When the adhesions are corrected, the vascularization will be improved by the reduction of the mechanical pressure on the blood vessels and the treatment of the viscerosomatic reflex as the hypersympathetic tone will be normalized.
The conclusion. There were no significant differences in oxygenation of the upper and lower extremities after receiving the GVOT in comparison with the control group after each treatment and on long term. Since there were some shortcomings, future studies could be aimed at demonstrating the effect of a GVOT on the oxygenation of the upper and lower extremities or the effect of a GVOT on the blood flow in the upper and lower extremities, both including certain modifications to the present study. The recommended modifications to the present study and further research on the effect of a GVOT on the oxygenation include choosing participants with a cardiorespiratory dysfunction instead of healthy participants with digestive complaints, maintaining a stable temperature in the treatment room, monitoring the heart rate and breathing rhythm of the participants until it's stabilized before starting the procedure, measuring the oxygenation by taking a sample of extracted blood, limiting the oxygenation measurements to measuring the oxygenation of the upper extremities, and performing some specific treatment techniques on the cardiorespiratory system in addition to the GVOT because of the key role of the cardiorespiratory system in tissue oxygenation. The recommended modifications to the present study and further research on the effect of a GVOT on the blood flow include, instead of using pulse oximetry for measuring the oxygenation, the echo-Doppler technique has to be used for measuring the blood flow and performing each GVOT technique until the adhesions are corrected to improve the vascularization instead of performing each GVOT technique a fixed amount of times. The references. We would like to thank the International Academy of Osteopathy for the given possibility to do our study in the Skills Lab in Ghent. Furthermore, we will also like to thank our promoters Kim van Overbeek and Bart de Swaaf for supporting us and giving us advice at the moments we needed it. Also a well-meant thank you to Inge Roman and Geert Bijtebier for teaching us the guidelines for the statistical lessons and for giving us an answer to our questions about the practical side of the study, and to our participants for their time. For the study, we worked together with 3 groups to investigate the effect of a general visceral osteopathic treatment on the trunk mobility, posturology, and the oxygenation of the upper and lower extremities. We would like to thank our co-researchers for a good collaboration. Last but not least, we would like to thank our friends and family for their moral support.